So welcome back, everyone. We're talking with Carrie Smalley, and she's a nurse practitioner and the owner of Stellar CARE Clinic. And we just heard your ad. I want you to tell everybody a little bit about yourself and what you do. Listen up, everyone, because you've made it pretty convenient for everybody to get health care.
Oh, absolutely.
And
Thanks,
more.
Carol, for having me back. So my name is Carrie Smalley. I'm a nurse practitioner with owner and provider with Stellar CARE Clinic. So I've been in healthcare for 30 years now. Wow, it's been a long time.
Wow.
So I have a wellness clinic that provides everything from nutrition, health coaching, weight loss, men's health, hormone replacement therapy, anti-aging solutions, and I can help anybody in Arizona all through the convenience of telehealth.
Telehealth, everybody, and this is where everybody wants. They want to know, they want to get their health care while driving.
Yes, absolutely.
Now, today you wanted to kind of talk a little bit about men's health and the services that you offer.
Yes, so men's health is one of the big services that I provide. So essentially this is testosterone replacement, treatments for things like erectile dysfunctions. My goal is to help men regain their vitality, get back to living their best life, and being the best versions of themselves that they can.
Why is testosterone replacement therapy important for men's health?
So testosterone therapy is so crucial. So everything from it affects men's well-being, their mood, how they feel, how they're functioning from day to day. And unfortunately, all the things we're getting exposed to today, everything from our unhealthy diets that we're doing, lack of physical activities because jobs are becoming more and more sedentary, things we're getting exposed to in the environment like BPAs from plastic bottles, pollution, heavy metals, these things are all acting as endocrine disruptors and they're affecting our hormones. And there was a study done by the HIMSS that was published in 2006, way back then in the United States, that showed that 39% of the men tested were low on testosterone. But unfortunately, men are going to their primary care doctors or their healthcare providers, and they're showing up with signs of chronic fatigue, they're feeling awful, they don't feel like themselves, they're gaining weight, they're losing muscle mass, they're having decreased motivation to really do anything with their life, their sexual health has gone down, they have no libido, or they're having problems with erectile dysfunction, and they go to the doctor, they run routine labs and they tell them they're fine, or they get diagnosed with depressions and they're putting them on antidepressants and they're feeling frustrated, they're feeling unheard. And testosterone replacement, if it's deemed appropriate, can really help a men gain their vitality back. This is affecting their relationships, their ability to perform at work, and it really helps them to just be back again.
Now, when you work with people, you do free consultations.
Yes.
And it's only telemedicine.
Yes.
This is the thing. You have to understand that this is how you do it, through telemedicine. And I got to ask you how you do that.
So essentially it starts with a good comprehensive assessment. So you can use your phone, a computer, literally it's a link that you follow and we kind of talk face to face just like we kind of are now. And we do starting with a comprehensive physical. So we talk about everything from your medical history, your surgical history, everything from your lifestyle, what you're eating on the day-to-day basis. I try to really dive deep into a person's health, everything from what they're eating, how they're sleeping, what their bothersome symptoms are, what their stressors are. These things all play a factor, and then we kind of do a bunch of blood work to make sure we're checking all the biomarkers that can be playing a factor in any of those symptoms. And then if we determine that the testosterone is low or other things are going on, we can help correct those and provide treatments for those right in the comfort of your own home.
Well, this is what's awesome. Now, I want to ask you, the testing that you do, the blood testing, are they different tests than what your regular doctor would do?
So typically the problem with the thing with testosterone is a lot of times they go in and do your routine blood work, which is typically like your blood counts, your thyroid, maybe screening your cholesterol, your kidney liver function, but they're not typically checking testosterone. This is very often missed, or people just don't ask for it when they go to ask for their plan of care. But
and they're embarrassed to tell them too, I bet.
Yes, or it's yes, especially with the things like the erectile dysfunction.
Mm-hmm.
It's a taboo. People don't want to, they feel embarrassed to talk to their provider about it. And that's one of the other benefits of the telemedicine is you can do it discreetly in the comfort of your own home.
Mm-hmm.
And if it's deemed that these medications are appropriate, they can be delivered discreetly right to your own home.
Now, the phone number to call is 928-267-3532. The website is stellarcareclinic.com, and it's only telemedicine, but in all of Arizona. Free consultations, and today we're talking about men's health. And I want to know, you diagnose this, and how do you know what the treatment's going to be? Is it different for everybody?
Yes, I mean, it's a younger population, obviously. If they're low on testosterone, you have to protect their fertility. So, and there's different things that people may want as far as, creams, pellets, injections. I only do the injections and the creams only because I'm telemedicine, so I can't inject pellets into somebody over the computer. But
that doesn't work.
That is an option. So with that, and then once we determine what's best fitting their lifestyle, then medications can be delivered right to their home.
So again, with erectile dysfunction, the services that they can, and it can be very discreet because you get to do everything from your own home.
Absolutely.
Okay, so now Carrie, as a certified fast metabolism, have I said it correctly?
A certified fast metabolism coach.
Oh, I said it wrong. See, there you go. And that's why I have people like you be able to talk for me. Sometimes I do get tongue-tied, for sure. Can you explain how nutrition impacts men's health and how the principles of fast metabolism, how do you say it?
Fast metabolism.
Metabolism, I'm sorry, I'm saying it so wrong, are integrated into your approach at the clinic. I'm not a doctor.
It's okay, I get tongue-tied all the
time.
So I'm a certified fast metabolism coach through Haley Pomeroy, who has studied nutrition and diet for over 30 years. And I 100% believe that medications are not a fix-all. We have to dive deep into your health and determine nutrition is paramount for all of these things. So even if you're taking medications, nutrition affects our ability to balance hormones. Nutrition deficiencies can affect our ability to not only produce but also maintain our hormone balance. So the fast metabolism diet essentially focuses on whole food nutrition and cycling it for specific times during the week in order to help slow metabolism but also fix nutritional deficiencies that could be affecting this hormonal imbalance. So I encourage all my patients to really focus on nutritional and health balances, so not only that they can feel better, but this is a lifelong health that we're trying to correct here.
And this is a specific diet.
Yes.
That you help and put them on.
Yes, it's
correct?
the fast metabolism diet. Haley Pomeroy's been around for over 30 years, so it's been around for a long time. But I definitely focus on these principles of that and try to really encourage the patients to incorporate these changes into their lifestyle.
It's easier for both men and women. Is a good diet for that, both?
Oh, both. It's not only good for weight loss, it can be used for inflammation, all kinds of disorders, GI, stomach issues. I mean, we really try to dive deep into your health to get you feeling the best you can be.
And you put them all on that diet as much as you can.
Yes, or at least encourage it. I mean, nobody's forced to do it at any point.
Right.
But nutrition plays such a huge factor in your overall health. It's junk in, junk out. If we're not treating our bodies well, and this can play such a huge factor in hormonal balance, weight loss, everything from inflammation, all these type of things.
And when you put them on the diet, how fast? Because a lot of people want to look good and feel good, especially if you're starting to work on your your erectile dysfunction. Now you really want to look good too.
No, absolutely. So when you go on these diets, I mean, it's different for everybody, because sometimes we'll start them on like a cleansing program and so forth, which kind of can really help kind of have dramatic effects where people are like, wow, I have a lot more energy, I'm feeling better, my skin
awesome.
does better. It's just all about putting proper nutrition into our body versus just pills that are just band-aiding.
Now, she's telehealth, and this is what's really neat, only telehealth, and she's all of Arizona. You could call her direct at 928-267-3532. The website is stellarcareclinic.com. So how does telehealth enhance the delivery of men's health services?
Well, the convenience of telehealth is number one. For busy professionals or even people that are retired, you don't have to drive an hour sitting in your car to get to an appointment or waiting 30 minutes in a waiting room or even taking time off if you're working. You can schedule an appointment, and the minute your appointment's due, you click on and you're there. And I mean, I've had patients do it on their work breaks, over the telephone, even doing consultations or talking about nutrition and kind of coaching them while they're on an hour-long driving home. So this allows people to access care so easily, and this way they can do it in the comfort of their own home at the time that's good for them.
Right, it's kind of like, when I think about it, I'm a little old school, because I think you got gotta be in person, but you don't necessarily have to for everything, correct?
No, absolutely. You could just talk just like we are now, and it
Mhm.
still feels very personable. I think people get afraid that it might not feel personable, but we really dive deep into everything, just if we're sitting in a room and talking, and, we go over all the labs. My goal is to make sure that people understand 100% where they are with their health, and they understand everything. A lot of times we go to the doctor and they give them numbers and they have no idea what they mean. I want them to know, and I want them to understand everything they can about their own health.
Right, it's so important for everybody, but also when we're talking about men's health especially, first of all, men don't like to talk about this at all, and to be able to talk to a doctor at the comfort of your own home, to have everything delivered at your home, it's all really perfect for the way men work. How would people get to know, what's the best way for them to get in touch with you?
So they can visit the website at stellarcareclinic.com, or they can call or text 928-267-3532. I'm happy to give free consultations, talk to anybody, answer questions. Just give me a call and I'll be there to help you.
Again, that phone number to call is 928-267-3532. You do way more than just men's health. A lot of different things, both women and men, right?
Yes,
Weight
absolutely.
loss, all sorts of things that you can do through telemedicine. All of Arizona she can help. She does free consultations. You can check her out on her website. It's stellarcareclinic.com, or call 928-267-3532. It's stellarcareclinic.com.